And then, okay, it started recording. And I'm also going to have it go live on YouTube. I don't think anyone's going to be signed on in that, but it's just for, just in case it doesn't record on this.
Okay.
Okay. It's preparing to live stream. In case it doesn't record on this. Okay, let me mute this. So, yeah, perfect. All right. Should we get started or do you want to wait until?
Yeah, that's fine. I mean, from Zooms that I've been on before, sometimes it takes people a few minutes to log in, and that way they can get all logged in and we can see how many people are here before we get started.
Okay, because there's 128 people in the waiting room right now.
Oh, wow. Okay.
Yeah, I was stressing too much and I'm like, I think I'm just going to pay for the extra couple hundred for, it's just too much of a hassle to get them all on YouTube Live and it's a lot.
Absolutely.
So I'm going to let people in because it is, okay, admit all, here we go.
All right.
Hello, everyone. Before we get started, I would just like to ask you guys to mute yourselves just so there's not a bunch of noises going on in the background, and it would be helpful for everyone. And if you have a question during any of this, we would ask that you please type it into the public chat. If you scroll down, there should be an option for chat, and if you click on it, you can click to everyone, and then you can type it in, and we're gonna have a little Q&A session in the middle, and then at the end, so we will like read those off, and we'll try to address them for you guys. Oh my. Get them all in. And we still have 2 more minutes, so I'm gonna let it get filled up, and I'll probably repeat that. But then we'll get started at 1 o'clock. Yeah, if you guys aren't able to stay for the whole thing, we are recording it and we are also live on YouTube. So if you guys aren't able to stay, we will post it on our YouTube page and we'll link it on our Instagram so you guys will be able to see. And as for this Zoom counting as shadowing hours, it does count as clinical hours, like clinical experience, because you guys will be learning about a day in a PA's life and like what they do and how to, get there. And that's like the closest we can get outside of a hospital. And you could just describe it as receiving the opportunity to discuss medical related topics with various healthcare professionals or like with a PA, and you learned about their profession. And even though it's not hands-on, it like provided you an overview with how impactful medicine can be, and like if it motivated you to pursue it, and like just how it impacted you and your experience with it. And honestly, at this point, like experience is experience, no matter if you got it over Zoom or in person. And it's that's how you could list it. I mean, it's better than listing nothing because, this is our only option at this point. Okay. Oh, it's 101. Let's get started. So, welcome everybody to Zooming Through Summer. My name is Kieran Gotra, and we are doing call number 2 with Chelsea, who is a PA doing a cardiothoracic residency in surgery. Before we get started, I would just like to thank you, Chelsea, for taking your time out to do this, taking time out of your schedule, because we know it's all hectic right now, to speak with us. And I'll just let you introduce yourself and get started.
All right. Hi, guys. So I'm Chelsea. So I'm a new graduate PA. I graduated in May, and I'm doing a cardiothoracic surgery residency. I was a non-traditional PA student. I didn't come right out of undergrad. I took a few years off as I was a single mother so I could finish my prerequisites and then apply. So I applied the fiscal year of when I was 25 to 26, and the program that I chose to accept, I started when I was 27. So that's kind of a little bit about my background. And actually, I was one of the median ages in my program. There were many people in their 30s, as well as 2 people who were 22. So there's a lot of different age groups. So if you're kind of worried about like, am I too old? Am I too young? Like, it goes across the board for PAs. So that's kind of a little bit of my background. So.
Okay. Just to get us started off, could you tell us more about your undergrad journey and how it led you all to become a PA?
Yeah, so I did my undergraduate at Niagara University. I did a double major in biochemistry and psychology. And actually, I didn't even know what a PA was in undergrad. I didn't know I wanted to be a PA. I always thought I wanted to be a physician. I wanted to be a psychiatrist, which is why I did a double major. And then I became pregnant in undergrad and thought my life was pretty much over and that I wasn't going to be able to pursue medicine, which is very inaccurate looking back, but I'm glad it happened that way because when I did graduate, I started working as a tech in medicine because I needed a job to support my son. And that's actually how I met PAs. And I realized that their work-life balance, as well as still being able to diagnose, treat, educate patients, was perfect for what I wanted in medicine. So actually, I didn't even know what a PA was in undergrad. I did my whole undergraduate, like, extracurriculars and those types of things geared towards pursuing medical school initially.
Okay, that's great. Pursuing it. And so for extracurricular wise in undergrad, like what would you suggest, like for a typical student who's like freshman, sophomore, getting started? What type of extracurriculars can I do to get see more experience with a PA, and what are some important steps I could take to become a PA?
So in undergrad, I think it's very important to do volunteering experience. PA schools really value that. They want to see you give back to your community and they want to see you be involved. And it's not just, oh, I did 10 1-hour community services. I mean, those are still valuable, but pick something that you consistently do. Like, you volunteered your time every Monday to coach a soccer team, or, it can be even something non-medical, but giving back to your community in any way you can. So volunteering is definitely a huge aspect. So if you can join clubs like biology clubs, American Chemical Societies, those were two that I was involved in, that you can give back, working at soup kitchens, homeless shelters, all sorts of things, doing cemetery cleanups. There are actually a lot of those where you can go like rake leaves. I did that. I joined a sorority, which was heavily weighted on community service. So actually I was required to do, I think, 20 hours a semester of community service. So I had quite a bit of that. I did like breast cancer walks. I did, we did like pie a sister in the face, and we donated all of that money to Relay for Life for cancer, those types of things. So I think it's really important to get involved in undergrad. Your studies are very important, do not get me wrong, but volunteering and community service is huge in the PA community. So that I definitely would suggest for a traditional student applying right out of undergrad. I think those can make you more competitive.
So you don't necessarily have to be doing all medical volunteering, and you don't have to be just so engulfed. It's like okay to have other interests and stuff.
Absolutely.
Okay.
They like well-rounded applicants. They want to see that you're a person. That's all about being a PA, is we're very personable, we're motivating, we're exciting. We like to see like what makes you different from me. We like to learn from those things. So we're definitely a team-based, collaboration-based approach, and we like to learn from different people's experiences.
Right. That's like, I feel like that would also be less stressful on you as well, not just having a constant medical focus. Like you can like branch out and explore other interests as well. Like that's cool. So were there any jobs that you did in a clinical setting during undergrad as a pre-PA? And like what kind of jobs would you recommend that a student who wants to pursue a PA degree, like what should they do, like jobs wise?
So in undergrad, I did like a home health aide. I think they're called direct support professionals now. So I worked with adults with disabilities like on weekends and stuff, basically doing, help feeding them, taking them on outings, those types of things. And actually it counts as patient care experience because you have to be CPR certified. So that's a really good thing that you can do in undergrad. I did all of my medical experience after undergrad, obviously, because I was a non-traditional student, but you also could do that if you want to work in undergrad as well. I know some people don't like working in undergrad, so that might be a little too much to balance with your extracurriculars, your studies, etc. But you very well could do that. So like my background after undergrad was I did psychiatric technician as well as orthopedic technician. So those gave me a lot of my patient care hours. I did a lot of hands-on experience, and you could do those. I didn't need a certification for any of those. I was your run-of-the-mill tech. I was trained on the job, and I got great experiences from those. And I know that those are held very valuably in PA school as well, and you could do that in undergrad.
So like if I wanted to find a job like that, could I just type it into Google, like jobs near me for that, and then just apply?
Yeah, so I actually looked at hospitals in my area. I specifically went to their web pages and went to, if you go under like careers, then you can say all jobs if you want. I filtered out anything that required a certification. That's how I did it. But you absolutely could just Google medical assisting jobs without the medical assistant title or being registered. There are some tech jobs that you have to have a certification for, like a surgical tech. There's no way you can be a surgical tech without a surgical tech license. So those are not going to be available to you guys if you don't have those certifications, but there are tech positions that you do not need a certification for.
Okay. So after you've done all that, like you've got your extracurriculars, you've got your jobs, like you've got your well-formed application, how did you start the application process, and like what did you go through, and just like how did you get the letters of rec, and do you have any tips for like personal statement and just formulating your application?
Yeah, so when it came to CASPA, I had started looking at what the requirements were at least, I want to say 2 months before it even opens. So it opens in April, I think like mid-April. And I made sure I knew what every piece involved in applying to PA school was going to involve. I looked at schools prior to even CASPA opening, and CASPA gives you a list of every requirement for every single school that you could apply to. So it gives you more information than sometimes you can find on their websites. But I suggest looking early because a lot of schools will have rolling admissions. So, they are going to have their deadline like, oh, your application is due August 1st and supplementals are due by September. But some schools are like, if you're bringing in your application in June, we'll be like, we like this candidate. We're going to interview that candidate. So it's important to look at your schools early. Know what schools you like, know what you like about those schools, and plan accordingly. So as for getting your shadowing hours, I know that's really difficult for you guys in this time right now, but there are clinics that do accept students for shadowing. Actually, my fiance is applying to medical school right now, and he just did 3 weeks of shadowing in a pediatric cardiology office. So if it's a private clinic, it's basically up to that physician or PA or NP or whoever you're trying to shadow if they'll accept you. So you could reach out. Worst case scenario, they say no to you, and then you have to do these types of things. But why not try? And that way, if you do get an interview, they can be like, I noticed all of your shadowing is online right now. Did you reach out to anybody? You can be like, actually, I reached out to 5 clinics, 2 hospitals, etc. That shows your dedication to the field. So that's important too. Obviously I didn't have to do that in my application process. I'm just trying to make it a little more relatable for you guys right now. For my letters of recommendation, they were all from PAs and MDs that I worked with. So it's very important that you have a PA that says they are good for this field, because we know what we want in our field. We know what we want represented. So if a PA is vouching for you, that's going to hold a lot of merit for us. We also really like to see MDs giving you letters of recommendation because we have supervising physicians. Those supervising physicians are going to want to know, is there an MD that would vouch for this person and be like, yes, they would be a great asset to the medical community. So I had 2 PAs, an MD, and a professor. You're only required to have 3 for most schools, but I wanted to also speak to my academic abilities, because I know some people probably have followed me, from my TikTok, so they know my GPA going in. So we'll just talk about that now. So it's out in the open. So actually my undergrad GPA was a 2.85, and I didn't focus my 2 years in undergrad, my first 2 years. Each semester I trended up, and so that would make my overall GPA 2.85. So when I decided I wanted to go to PA school, I saw that I didn't meet the minimum requirements. But I also hadn't taken micro, I hadn't taken A&P, I hadn't taken genetics. So I took all of those courses while I was working as a tech, and I maintained a 4.0 in all of my prerequisite courses. So my applying GPA was 3.01. And do not let that deter you. Yes, GPA is important, so I'm not saying slack in your courses by any means, but you can get accepted with a low GPA. There are a lot of people who are like, no, the average GPA is 3.7. Yeah, that is the average GPA, but you have to remember that's an average, and there are outliers. And in PA school, I had a 4.0 every single semester for all 2.5 years.
Wow.
I was nominated for the National Society of PAs, and I was inducted at graduation, and I didn't realize I was getting that. My program nominated me. So you can turn it around. You're not defined by your past experiences. A lot of us are young when we enter college. You're 17, 18. I was 17 as a freshman. So don't let your GPA hinder you from even applying to PA school. It will be hard, and you will get a lot of rejections. I think I had like 7 rejections right off the bat. And it's probably because I got weeded out from my GPA. But you're going to have programs that are like, you know what? Look at their volunteer experience. Look at their patient care experience. Look at these letters of rec. Look at this personal statement. You can tell she has a passion for the field, or he has a passion for the field. So you really want to make your application holistic in a sense, because you don't want you don't want to go in thinking, well, I already have an undergrad GPA of 4.0, so I'm a shoo-in. No, you don't want to look at that because it's not just about the grades.
Right.
So I think it's very important that you look at what the school wants and what they value as a program, and that's what you really want to kind of push in your application if you're applying to that school.
Mm-hmm. So like even going back to the GPA thing, like you said, yours was a 3.01, but let's say someone has like a 2.9 or something that's like almost a 3.0. How, like in a personal statement, how would you suggest like addressing that?
So if you want to address it in your personal statement, you need to do it in a professional way, but also you need to take responsibility for that grade and that overall GPA. So you need to be able to say, like, yes, this happened. I'm not making excuses for that GPA. I was undriven, unmotivated. You can use those types of words and then turn it into a positive. What did you learn from it? What are you going to bring to this PA program? How do we know it's not going to happen again? Did you change your study habits? Was there some big life experience that did alter like one semester of your GPA where like maybe you got like a 0.9 and it just tanked your overall? There are things like that, where a death in the family can be a huge altering factor in some applicant's life. I know someone in my program who was like that. And even though they had a 3, like 8 every other time, their one semester really tanked their GPA. So they wrote about that. So you can address those things. I chose not to address my undergrad grades in my personal statement, mainly because I wanted them to meet me in person. I addressed it in my interviews. So my personal statement had nothing to do with any of the grades of my undergrad GPA, and I still managed to get interviews. So I don't think it's mandatory to address a low GPA in your personal statement, but it's also not wrong. You can do it both ways.
Mm-hmm. So, along with your GPA and your extracurriculars and stuff like that, were there any exams, like big tests you had to take? Like, for doctors, it's the MCAT, like, and for dental students, it's like the DAT. Like, what type of tests did you have to take?
So I had to take the GRE,
Mm-hmm.
which is a terrible test. That's my opinion. So I used the Kaplan resources to study for that, to do the verbal and the quantitative, and I did practice writing online. So I paid that, like, I think it's like $300, or at least it was 2.5 years ago when I was taking it. It's a standardized test. It's kind of a brutal test. It really has not much to do with medicine. I think it's more assessing, are you able to read medical literature and high intense vocabulary? I really think that that's what they're assessing in that. I know now, like, even my program has changed with their requirements. I looked on their website earlier this week, and they require the Casper test now, and they require the PA CAT, which I didn't have to take. That just started in the last 2 years. So those I can't really speak to because I've never had to take them. But I know that those are tests that some programs are requiring. So they're definitely tests that you want to look into. And I'm sorry, I can't really give you much info on that. But definitely for the GRE, I would take the Kaplan books and flashcards. I would bring them to work with me when I was a tech. And in between patients, I would be flipping through the vocab flashcards, and then I would like write a timed essay that evening. And I studied for about 3 months for that prior to taking it.
Mm-hmm. So with all of that, what would you say, like one last question just to wrap up the whole application process, like what would you say that the best thing would be for a student to do in college to stand out from like every other applicant? What can I do to be above and beyond, essentially?
I think patient care experience is going to hold the most merit. And that's my personal opinion. But I know that, a lot of my classmates, a ton of us had on average about 3,000 patient care hours, direct patient care. So that is something that's really important because in medical school, you get 4 years to learn how to talk to patients. In PA school, you get 1 year basically, because the next year you are on clinicals, and they want to see, like, are you going to be able to be adaptive? Are you going to be able to be thrown into these clinicals after trying to stuff one year of medicine into your brain and go out there and treat patients.
Right.
So I think that patient care experience is definitely a huge factor if you're an undergrad, because everybody's going to have good well, the majority of people are going to have good grades. Majority of people are going to have a good GPA. Majority of people are going to find some way to write a awesome personal statement and have great letters of recommendation, because you probably wouldn't ask somebody to write you a letter of rec if you didn't think it was
Right.
a good one.
Mm-hmm.
But patient care experience and volunteering is something that, you know, I think is going to really make you stand out, make those things count.
Mm-hmm. So, for 10 minutes, maybe we could go through the questions on just the undergrad portion, and then after we get like the gist, like the most of those, we can move on to what you do now and your life now. So, a big one that I saw for from people was any tips for interviews? What should we expect / prepare for?
Yeah, so I don't know if you guys have followed the Physician Assistant Forum, but it is an amazing resource that's free. You can sign up with your email, and every single school has like their own link, and you can follow what people have said about past interviews, about current interviews, because every school is going to be different. Some schools are going to do what are called MMIs, which are like multi-mini interviews, where like you go to a door and you open it and you have 1 minute to do whatever the sign on the door says. So whether it's like putting on sterile gloves or those types of things, like they have things like those. Or you could get a panel interview, where you are one person sitting in front of 10 faculty members and they're all asking you questions. You could have a panel conjoined interview where the faculty is in front of all like 75 of you that they're interviewing, and you have to balance between answering enough that you're getting noticed, but not where you're overpowering other people who you should be working with as a colleague, type of thing. And then there's other ones that are all day interviews, where you have multiple like 15-minute individual interviews. So it depends on what your school is doing on how you can prepare for that. I think that the PA platform and Savannah Perry, she's a PA in Durham. I did a mock interview with her, and you know, I told her about my school. I told her their style, and she made an interview for me. It was about 45 minutes long, where she kind of grilled me with questions, and then she typed up my responses and her critiques for those and what I could improve on. And honestly, it was the best $100 I ever spent, because you can practice all day long in, you know, your bedroom with your family members, but unless you're practicing with somebody who really knows the answers that are going to leave impactful impressions. I think that that was such a good play on my part, because it really helped me and she gave me a lot of great feedback. And I think you guys should really check out her platform for interview tips, because it's really good in that aspect.
That's great. And then there's another one that was really big I saw in the comments was, do you think taking a gap year and breaks as an EMT or like any other patient care experience would be enough hours of patient to get enough hours essentially to get into PA school, like
Oh
gap
yeah,
year?
for sure. You don't have to have, you know, the crazy 6,000 hours that I had. There are plenty of people, like there were 3 people in my class, you know, who worked in RP. They requirements enough patient care hours. Just make them count. You know, if your boss says, hey, do you want to pick up an extra shift on the weekend, be like, yeah, I actually do. Get that experience. And then you can also show that's dedication to medicine. You can talk about that in your interviews. You know, you could be like, I'm very dedicated and passionate about the field. Anytime there were spare shifts, I volunteered for them. You know, those types of things, you can show that. So definitely even 1 semester is enough patient care, as long as you meet this minimum hours for the school you're applying to.
Okay. So moving on to like your current life and work experience, can you tell us what your current job as a PA looks like and like what do you do in a typical day? How many patients do you see? Like stuff like that?
Yeah, so obviously just like you guys are as affected in shadowing, I was affected in practicing. So I actually, my start date got pushed back because of COVID. So licensing and credentialing and taking my boards all got pushed back. So I haven't started yet. I actually moved to New Hampshire next Friday. That's why my house looks such a mess right now. I'm sorry for that. But I can tell you what it was like while I was on my
Mm-hmm.
rotation, which is going to be equivalent to my residency.
Battery.
Sorry. Could you guys please
Battery.
mute yourselves? It's kind of got a lot of background noise. Thank you.
So a typical day in cardiothoracic surgery is you get to the hospital between like 5:30 and 6 in the morning. You immediately change into hospital scrubs, and then you go round on patients in the CVICU. So depending on what patients are yours, because some patients will be the intensivist or straight cardiology and not surgical, you wouldn't round on those patients, but you're going to round on all of your surgical cases. And then you're going to report off to either the nurse practitioner or PA who will be managing the floor while you're in cases. And then you report on rounds. So the surgeons will come in and you will do rounds with the surgeon on every single patient. Then you'll go down, you'll scrub into whatever case you're assigned to, whether that be a valve case or a cabbage, all of those types of procedures. It depends on that day. Aortic aneurysms. And then once you've completed those cases, you take your patient back up to the ICU. You watch them for probably the first hour because it's pretty critical. They can tank really fast after that first hour. And then once they're stable, you'll write all your notes. You can check on any post-ops. If you're the PA on call, you might be doing consults or new admits or emergent cases that now need to go down to the OR that you're going to be doing with the surgeon. Taking phone calls, basically doing any procedures that you need to. If somebody needs a new chest tube, if somebody needs a central line, a swan, their balloon pump pulled, those types of things. So you're kind of just doing like procedural things, finishing your notes, and then you leave. In CT surgery, you're going to be taking call. So there were days that I would get home usually around 6 p.m., which is like 12 hours, 5 days a week. But there were days that I were home at 8 p.m. and 11 p.m. And then I'd literally go home, eat, sleep, get up at 4 and do it again. So just in my rotation, I worked usually about 60 to 65 hours a week. So it'll be probably pretty equivalent to my residency because, if not more, because my preceptors would be like, you can go home, I'm just writing notes. And sometimes I would stay and study, but sometimes, if it was 11 p.m., I'm like, okay, well, I have to be back in like 5.5 hours, so I probably should go to sleep and eat something. So I would say between 60 to 65 hours a week is equivalent to what I'm going to be doing in residency. And they did tell me that in my interview. That's about what the current residents were working at the time, because it is a demanding field. So you have to be okay with a very flexible schedule. You're going to work weekends if you're on call. You're going to take night call. You have to know that, a 4-hour case can turn into 12 hours. I remember going to the OR and I didn't eat breakfast that morning, and I should have. And it was just supposed to be a quick valve for 4 hours. And we were in there for almost 16 hours and I didn't eat anything that day. So that was rough. And I was a little shaky when I was suturing because I was very hungry and low on blood sugar. But you have to know that that can definitely change if you're thinking of a surgical field. Like, it's very unpredictable. So it's hard to give you a set hard and fast of what every day looks like, because you could have no cases that day, or you could have 3 emergent cases from, other hospitals that can't do cardiac surgery. And now you're running to the OR for 3 ruptured aneurysms, those types of things. So it's very unpredictable in a sense.
So how did you know that this was for you? Like, how did you pick cardiothoracic surgery? Like, that's crazy.
So I went in to PA school not ever intending on doing surgery. Even when I got to my clinical rotations, my second rotation was gen surge. And I was like, it's just 5 weeks. You can do anything for 5 weeks. I was not looking forward to surgery. And I loved it. And it was one of my most favorite rotations. That surgeon had offered me a job. He still wants me to come back. He wrote my letter of rec for CT surgery. And I was like, you know what? I wonder if I can get any of more of my rotations in any surgical field, because I really like this and I think I want to do gen surgery when I graduate. So I told my program that, and so my OBGYN rotation, they made surgical, and loved that too. I got to do so much, and I spent so many hours in the OR with my OBGYN. He was a fertility doctor too, so I got to do a lot of like IUIs and those types of things, which was awesome. And so I was like, well, I really like cardiology and I really like surgery. I wonder if I can blend the two. And so we got an email about a cardiac surgeon who was willing to take a PA from my program for 5 weeks. And I emailed back and I said, I'm interested. And from day one through the whole 5 weeks, I was obsessed with it and I couldn't imagine doing anything else. And even though I had offers in general surgery, I had offers in orthopedic surgery because that was my other elective. I was like, I would regret it. I need to be in cardiac surgery. This is what I need to do. So my cardiac rotation had offered me a job, and COVID pushed it back for a while. So I accepted other interviews. I decided to apply to this residency because most cardiothoracic surgery jobs, you have to have 5 years experience. The only reason my elective was willing to hire me was because I did my elective there. So they knew my knowledge base, they knew my drive for the field because it is demanding. And, you know, not many people like working 65 hours. It's really not a normal thing to like. I'd rather be in the OR than, you know, at home. Like, it's just a very exciting field for me. So, you know, if that's something you're interested in, a very like specialized field like that, then on your rotations, advocate for yourself. Be like, you know, I'm really interested in surgery and I know that, you know, you can only have so many hours in 5 weeks. Like, can I do a surgical OBGYN rotation? Can I do 2 surgical electives? That's how I got 4 surgical rotations, was by advocating for myself. So I think that that's very important to do, if you can. Some programs don't. I know, you know, a couple of students that I've met on rotations from other programs and they're like, oh, we never got to pick our rotations. So if you are interviewing, ask those students that. Be like, do you get to pick your rotations or have a say in your rotations? So like my program, we didn't get to pick exactly where we were going, but we could advocate and be like, if there is something in this area, can you put me there? And they would work really hard to do that. Sometimes they couldn't. But sometimes they could. So I would make sure that you ask any current students at any programs you guys will be interviewing at, if they have a say in their rotations, especially if you're interested in those types of fields.
Like, how long does residency last for you, and compared to like other PA residencies? Like, I know there's derm, there's so many, I can't even list them all, but like how long is it in comparison to others?
So mine is 12 months. And that's like not a hard and fast rule. So when I accepted the residency, they told me, you know, we want you to be here the whole 12 months. That's how you're going to get your certificate. But if a job were to hire you and say you had to start at month 10, we would meet as a committee and say, do we think that she's ready to have her certificate 2 months early? And they said they have done that for people before. So it's really not a hard and fast like PA program where like you cannot graduate till you graduate, because technically I'm a board certified PA. I could practice right now if I wanted to. I'm choosing to have more structured learning in a very intense field. So there is a difference. So when I'm in the ICU, I am treated like a PA. I get to make my own medical decisions, etc. I'm really the student in the OR, and it's because I'm learning how to do things that I actually didn't get to do in PA school. So I'm getting trained in bronchoscopies. I'm getting trained in how to harvest the vein by myself. So I get to actually start my own mini surgery on the leg by myself. The surgeon's not down at the leg with me, those types of things. So that's really why I chose a residency, is because I felt that coming out of that, I was going to be so much more marketable. I could go anywhere. And I'm going to be more confident in my abilities. You know, a lot of these patients are intubated and sedated. They can't tell you what's wrong with them. Whereas, like, I can walk into, you know, my family practice clinic and be like, what brings you in today? What are your symptoms? Tell me about that. Ask those types of questions.
Mm-hmm.
These patients, I have to look at their numbers on the wall and be able to formulate, are they okay versus are they not okay, and what do I want to do for them when they can't tell me, like, oh, it hurts here, or anything like that. So I just wanted more experience, and that's not for everyone. I very well could have taken a new grad position. It's just it's the difference between training for 3 months and being expected to be able to function at the same level as somebody who's working there for 25 years? Or do I want 12 months where I can be like, it's okay, like, I don't know how to do this. Can we go over it? And you don't lose any sort of respect in that aspect, because they're like, yes, please ask questions, you know, those types of things. My classmate she accepted dermatology position, and they're making her do a 3-month residency prior to her like practicing. So I think twice a week she's sending me pictures, and she's been studying. She does like a didactic portion where she's in the classroom, basically learning all sorts of derm. But then twice a week she's not shadowing, but seeing patients with another PA. She doesn't have her own patients yet, and that's how they're kind of training her. So it's like a residency, not residency. So that could be a little bit different, but most are going to be 12 months.
Okay. A common question that I'm seeing in here, I've seen it so many times, is do you get paid in residency, and like how much is it compared to a normal PA? And also, while we're talking about residency, do you take tests and study during residency as well?
So I do get paid in residency. It's obviously much lower than a new grad salary, but you get paid more out of residency. So when I apply to jobs, it's counted as experience, and it's counted as in more depth experience. You actually get a higher salary coming out of residency, and you can negotiate those contracts because you're like, well, I have a certification in this exact field, so I would like to be credited for that. I'm not a new grad. I do have a year of intensive training, those types of things. So salaries can range. There are 2 other classmates of mine who accepted residencies. One was just like a general surgical residency, and another one accepted a emergency residency, and all 3 of us are getting paid differently. So it really depends on that program. But most of them range anywhere from 50 to 75,000. So it's essentially like medical residents. They make like 50 to 60,000 a year. You don't make much, but what you get out of it is so much better, because you don't have to pay for the residency at all. So like, you're not paying for school at all. So like, you have to think about it like that. Like, you're getting all of these textbooks. Like, I get my loops for free. I get my coats for free. I get all my books for free. All of my classes are free. So like, you have to like think of it in that respect. They're paying me to teach me. So like, that's a good thing. So average new grad salary is around 100,000 right now. So yeah, I do get paid significantly less than a lot of my classmates, but I'll be able to ask for more in a year. And I feel like my decision, because of the field I'm in, was the best decision for me. Had I wanted to go into internal med, family med, peds, anything like that, I wouldn't have done a residency. It was specifically because I was doing such an intense surgical training specifically.
And just an overall, like, if you were a freshman at undergrad, would you pick this journey again over like nurse practitioner or a doctor, MD, DO? Like, would you pick it all again?
Yep, absolutely. Absolutely. It was the best decision of my life. And PAs are huge on lifelong learning. And I think that's really important to know in medicine, because it's really easy to get into a routine and be like, yeah, I mean, I've been doing this for 30 years. I know what I'm doing. I remember being on my internal medicine rotation, and we had a patient, and I was like, I think she has this disease. And my preceptor was like, nah, I don't think so. And he was a very well respected PA. He had been practicing, I think it was close to 35 years. And so I doubted myself, because I'm like, what do I know? I've been in PA school for a year and a half. And they consulted a rheumatologist, and he said, well, because this diagnosis is so high, I think we should run these tests. And he goes, wow, my student said that to me today. And it made me feel really good, because like, just because you're a student, it's okay to like voice your opinion. Like, sometimes you get in such a routine that you kind of forget to see other things, and those new motivated students are going to come in and be like, let's do this, let's order this test. And they can be right. So like, that's a huge part of being a PA, is he literally looked at me and he's like, you got that, you're the reason that we diagnosed this patient. Like, she's been in the hospital for 3 weeks, you come along and we figure it out. Like, so like, they're very humble people. They're willing, and obviously there are going to be some that you will come across that maybe aren't, but the majority of PAs are. And that's what I love about the field, is they're not afraid to admit when they're wrong, and they're not afraid to admit when someone else is right. And I hope to be like that for the rest of my life. So I would do it again.
That's awesome. That's actually really cool that you got to diagnose that when everyone else was struggling. So like, what would you say to someone who's struggling picking between nurse practitioner or doctor and PA? Like, what would you tell them?
So for MD, obviously it's going to be a lot of schooling. You have to pick a specialty. So PAs do not have to pick specialties. We have lateral mobility. So I can work in cardiac surgery for 10 years, and then I decide I want to work in pediatrics, and I can, and I'm allowed. A physician can't do that, and neither can a nurse practitioner. So that was a huge factor for me, as I was like, well, what if I pick a specialty and I don't like it? Because I always thought I was going to do, psych or ortho. And when I rotated in both of them, I'm like, this isn't the life for me. This isn't what I see myself doing. And what if I had chose psych NP or medical school, and I was in psychiatric residency, and I was like, this is not what I want to do for the rest of my life. I'd be miserable. So I really like that about the PA field. I also was a mom when I applied, and I didn't want to be away for 8 years, 4 years of medical school, 4 years of residency. Plus sometimes they're 7-year residencies. And so 2.5 years of being away from my son was more ideal for me. I'm also okay not being the top dog. I'm okay saying that I need help, and I'm okay being like, I should look to my physician for this. But if I am the physician, who do you kind of turn to when you don't know what's wrong with the patient, like, so I liked that about the PA aspect as well. But they're both great fields. So if you want to pursue medical doctor, that is perfectly fine. That was just reasons why I chose between those two. For NP, they're trained in the nursing model, and I really wanted to be trained as similar to a physician as I could. So PAs are trained in the medical model. So we learn everything they learn in medical school in crunch time. So you learn it in 1 year, they get 4 years. So they learn it a little more in depth pathophys wise, because, like my friend Thomas was in medical school while I was in PA school. He got 4 months for GI. I got 2 weeks to learn GI, so like, you have to look at it in that respect too. So like, they get to learn it a lot more in depth pathophys why, but you're learning the same things that they are. You're learning that you need to diagnose a disease based off XYZ, and nursing is just a little more of a holistic approach, which isn't wrong by any means. It just wasn't the way I wanted to be trained. And I would have to go back and get my RN, because I'm not an RN. So you have to be an RN, and then you can be an NP. And I was like, well, why would I take 2 sets of boards to become an advanced practitioner when I can go right to PA school? So also still a great field. I know a ton of amazing NPs, and essentially treating the patient really isn't that different. It's just the way you learn how to approach that patient. That's really the difference.
Right. You mentioned in there about like you get to pick your specialty because it's so easy to switch specialties too because like it's not as long as it would be for like an MD or something. So how do you go about the approach of like switching a residency? So if I'm like in derm and I decide all of a sudden like I don't like it and I want to switch, like how do I do that?
You literally just apply. You can just change. You don't need to go back and get any certifications. I mean, it would help if like your CME probably was geared toward a different specialty. Um, so CME is continuing medical educations, and that's where we have to do like 100 hours every 2 years to maintain certification. So say I wanted to do pediatrics, I probably would put my CME money towards anything pediatric based, like vaccines, those types of things. But when I was applying for residency, there was actually a PA who was applying for the residency. I know because we were in the interview together, and she wasn't in cardiac or thoracic at all. And she was just like, I'm looking for a change. And so I decided I wanted to go to CT surgery, but they don't accept somebody without experience. So I decided to apply to a residency. I was like, oh, that's really interesting. So that's an example where she just went for it. Like, you can just do it. You don't have to go back and explain yourself. But they probably would question, oh, you've done this for so long. What even interested you in this? And you could be like, oh, I learned in this CME that XYZ, this is why I want to change specialties, and you just can.
Mm-hmm. Wow. I didn't realize it was like you can just apply and just move. That's actually
Yeah.
kind of neat.
Right out of residency, I could be like, you know what, I decided this isn't for me. I'm going to change. I doubt that I would do that, but I could.
Yeah. Another question that's kind of big is someone said, I heard that a lot of places don't hire new grad PAs, therefore making it hard to find a job. Is this true or does it depend on your area?
Really depends on your area. I had, for new grad positions, I think I interviewed probably 11 places. Um, and I was offered 4 positions. So, I mean, anytime you're applying out of school, it's going to be difficult because everybody else is graduating and probably applying too. So a lot of the places that I applied, so did some of my classmates. So you're kind of competing against each other in a sense, which kind of sucks because you've been pulling each other through for the last 2.5 years, and now you're kind of competitors. Um, but there are plenty of places that love new grads. A lot of places really like to mold you into what they want and actually prefer you over somebody with experience, because somebody with experience, might have learned a different way from a different attending, and they're like, well, I don't want to like get them out of this habit to teach them this habit. Whereas they're like, a new grad, I can just be like, this is what you're doing, this is how you do it, and they do it the way that I like it. So there are plenty of new grad positions. More than half of my class had jobs 2 months before we even graduated, myself included.
Okay. So just to like wrap it all up, like, do you have any like final words of advice for us? Like anything just overall in general that you just like to know, like let us know?
Yeah, so I think that you need to have your list of schools that you want to apply to, write them down and write every single requirement that that school has and what that school values most. So like my school was huge on community, huge on rural practicing medicine, those types of things. So I made sure that I had all of the aspects that made me an ideal candidate to fit with that program. And I knew why I wanted to apply to that program. So I think you need to have that list. My suggestion, because of how competitive the process is you have 3 target schools, which are your like, these 3 schools, I've matched my statistics to pretty much whoever gets accepted there. I have a really good shot of getting in there. So minimum 3 target schools. Then I suggest 2 reach schools where you're like, my stats aren't great for this program, but I think my personality and what I see myself bringing to this community fits with this picture. I'm going to try for those 2 schools, but I know that I don't have a perfect chance at it. And then you have 2 safety schools. And those 2 schools are going to be like, I exceed the requirements for this program, and I think that I would be great for those programs. So minimum, you really should be applying to like 7 schools really minimum, because of how competitive it is. I do know people who have applied to one program and got into that program, and those are great. But if you're going to be spending all this money and going through the process, why not just give it your all so
Right.
that you only have to do it that one time?
Mm-hmm.
So knowing every requirement for every school, and do not listen to people who tell you you can't do it. I am a prime example of that. And that's why I like motivating pre-PA students, is because I've seen a lot of people put other people down for their GPA, their patient care hours, their lack of volunteering, their lack of leadership experience, XYZ. And I'm like, you are not defined by anything in your past. It's just, what are you going to bring to the future, and what are you going to bring to our profession? So my big thing is I'm going to advocate for any student who feels like they're the underdog, because I was the underdog. And did I get a lot of rejections? Yes. And everyone hurt just as bad. So you are going to get rejections, and do not think you won't, because everyone in my program who was accepted was like, dude, those rejections were rough, and it sucks. But you have to know that there will be someone on that admissions committee. You only need one person to fight for you. You only need one person to see something in you and is like, this person deserves an interview. And you only need to find one person on that admissions committee to be like, this person needs to be in our program. So those are things you want to do, is you want to tailor your application to that program. Don't make it broad. Find schools that are very similar, apply to them, and try to make the 2 reach, 3 target, 2 safety. And I think that those are all going to help anybody.
Thank you so much. That's really great advice for someone who might not know like what to do, because it's like a super complicated process, and just with everything going on, it's just a lot. So thank you so much for coming and speaking with us. It means a lot. And I see you guys are asking if we can use this as virtual shadowing, and if this counts as clinical hours. So if you guys do write this down, I would write it down as clinical experience, and you could just describe it as receive the opportunity to discuss medical topics related with PA and other healthcare specialties. And if you decide to join other Zoom sessions. And this experience was obviously not hands-on, and I would include that because it's important to specify, but it did, like, you could explain how it provided an overview about how it could impact you and like what you learned and how the overall format was. And you can say anything related to how it was for you. And experience is experience, guys. So being able to list this is better than being able to list nothing, which is the only other option at this point with the virus going on. So thank you all for coming. If you guys want more updates or more opportunities like this, make sure you follow our Instagram, because we are always posting stuff on there with new calls or reminders and stuff like that. And we will see you all next time.
Thank
Bye.
you guys for coming.